Good morning, everyone. FAST fast. Keep that in mind. Welcome to part one of the Greater Utica Rome Stroke Conversations, hosted by the American Stroke Association and sponsored by Rome Health as part of their support of America's Greatest Heart Run and Walk, set for May 15th. That will be a digital experience. I'm Kathy McCarthy, Senior Director of Communications for the American Heart Association and American Stroke Association. The American Stroke Association is a division of the American Heart Association, and we want to hear from you during our time together this afternoon. If you have a specific question for our panelists, type them in the chat box. We also invite you to share any comments or input you have in the chat box today. Make sure to select all panelists and attendees. You can find the chat icon on the Zoom toolbar at the bottom of your screen. We also invite you to join the conversation on social media. Please use the handles and hashtags on your screen for social media throughout our event today. Our hashtag is HeartRunWalk. For the American Heart Association, all of our social media sites are at AHA New York. That's Facebook, Twitter, and Instagram. Rome Health, you can use theirs too. Please tag them on Facebook. They are Rome Hospital. On Twitter and not Amsterdam, on Twitter and Instagram, they're Rome Health. As a reminder, we are recording the conversation and it will be available on demand through the webinar link. We also invite you to participate in our polls today. A dialog box will appear on your screen like the one that you see. So let's try this out and let's see which group best describes you as a stakeholder in today's conversation. Are you a first responder? Are you a medical professional? Are you a community or corporate partner? Or are you a survivor? Go ahead and tick the one that applies to you and we'll read the results. Looks like we have a lot of community and corporate partners and some survivors. Thank you for all being here with us today. This is going to be a very important conversation. And to get us started, I'd like to introduce the Executive Director of the American Heart Association in the Greater Utica Rome area, Christine Kissel. Christine?
Thank you, Kathy. And thank you all for being here today. Even in a time of COVID, stroke remains the #5 cause of death in our nation and a leading cause of disability. The American Stroke Association is committed to changing that statistic. We're grateful to Rome Health for hosting this series of community conversations that will give us all the tools to prevent stroke. We're also grateful for their support of America's Greatest Heart Run and Walk, set for May 15th. Please take some time to register for this, inform your own team, and enjoy a nice day of walking or running. You can register at uticaheartrunwalk.org. By being part of this event, you are helping us fight stroke in the Mohawk Valley and beyond.
Thank you, Christine. Today, we begin our three-part series and conversation on how stroke affects our region. More importantly, we are beginning a dialogue to discover and chart a meaningful path forward to better stroke care and prevention in our region. We felt it was important to bring together medical experts, first responders, survivors, and the community to understand, discuss, and reflect on why stroke is the #1 cause of disability and the #5 cause of death for Americans. Before we start, let's hear from someone affected by stroke.
Hi, my name is Amber, and I'm 38 years old, and I had a stroke this past year. I consider myself a pretty healthy person. I work out every day, and I eat pretty clean, so I'm one of those people that thought nothing like this could happen to me. It turns out that the brand of birth control that I was on caused a blood clot, and I had a hole in my heart that I didn't know about, which allowed the blood clot to pass through my heart and into my brain. And so I lost feeling in the right side of my body, and I had to be given a dose of TPA in order to break up the clot. After that, I was left with paralysis on the left side of my face for about a month, which is better now, but was very discouraging to go through at the time. Um, One thing that my doctor told me was that 25% of the population is actually born with a hole in their heart and doesn't even know it. So I wanted to make people aware that this can happen to anyone, healthy people, young people. It's not just older people. I'm doing really good now. I have some anxiety that stems from the fact that I had the stroke and just worrying that it might happen again. But my stroke was in June, and I'm 4 months out now, and I'm back to working out, and I'm back to work, and I'm feeling great.
Thank you, Amber, for sharing your story. I'm struck by how young Amber is. I often think that stroke only affects older people, so that makes our work today even more important. And we're joined today by a panel of local experts who will help us frame our conversation. Dr. Julie Kenda, the Stroke Program Medical Director at Rome Health, is here. So is Dr. Russell Silverman, the Chief Medical Officer at Rome Health, and Paul Taylor, the President and CEO of AmCare Ambulance Services. We're delighted to have you all here today. We'll hear more from all of them in a few minutes. But before we bring them on, let's start with the signs and symptoms and how the American Stroke Association, a division of the American Heart Association, is educating people about these signs and symptoms. We're going to start with a poll to do that. And our question is, what would you do if you recognized signs and symptoms of a stroke? Would you call a doctor? Would you call 911? Or would you drive to the closest hospital? Take a second and make your choice. Awesome job, everybody. 100% of the people said to call 911. And that is exactly what you want to do. That will get the treatment started right away. And that we will hear a little bit more about why that is important, but please do call 911. And we have another poll question. We really want you involved with us today. How confident are you that the closest members of your family would be able to identify stroke symptoms? Are you very confident, somewhat confident, or not confident? Once again, please take a second and vote on that. Somewhat confident. I think that's pretty good. And I hope by the time our time is up together, we really get that to more people being very confident. So thank you. So let's talk a little bit about the signs and symptoms of stroke. And I'm going to ask one of our panelists to jump on a little bit early and talk a little bit about FAST. Dr. Kenda, would you like to jump in here?
Yes, hi. Hello, everybody. Welcome. So we use in the medical field a mnemonic called FAST. It's very easy to remember, and it stands for face, arm, speech, and time to call 911. Face is for detecting a facial droop. Arm is for having arm weakness or numbness or drift. And S is for speech difficulty, which can either be someone can't speak properly, or when they're speaking, they're having slurred speech. And if they have any of those symptoms, it is time to call 911.
Thank you so much, Dr. Kenda. I appreciate that. And now you've already seen her, but let me properly introduce Dr. Kenda. She is the Stroke Program Medical Director at Rome Health. She earned her doctorate degree from Midwestern University in Glendale, Arizona. She's a board certified emergency physician working at multiple emergency departments here in Central New York with a special interest in stroke. She completed her residency in emergency medicine at Arrowhead Regional Medical Center of San Bernardino County in Colton, California, after a traditional rotating internship at Providence Hospital of St. John Health System in Southfield, Michigan. She is a member of the American College of Emergency Physicians, the Society of Academic Emergency Medicine, the American College of Osteopathic Emergency Physicians, and the American Osteopathic Association. Before her current position in Central New York, Dr. Kenda was affiliated with Emergency Medical Associates at St. Peter's Hospital in Albany, New York, as an emergency medicine physician. Prior to that, she was the stroke medical director at Virginia Tech Carry-On Clinic, a comprehensive stroke center in Roanoke, Virginia, and she also served on the Virginia Stroke Systems Task Force. Dr. Kenda has been on the front line of emergency stroke care for years now and has a passion for bringing awareness to our community about stroke risk factors, prevention, and early recognition. Thank you, Dr. Kenda, for bringing that expertise and experience to us today.
Thank you for
Great. As a clinician, you're on the front lines in acute stroke care. So you just talked a little bit about the most common signs and symptoms of stroke, our friend FAST. You want to talk a little bit more about that?
Sure. Thank you, Kathy. So as we mentioned, we really try to recognize signs and symptoms of stroke right when they happen, because we know time is brain and time is of the essence. So the earlier we recognize that someone is having a stroke, the better candidate they can be for any kind of medical treatment. So FAST is the mnemonic that we like to use, the paramedics and the ER and the hospital. F stands for facial droop. So you may see that your loved one has one side of their face that's a little more droopy than the other side, and it doesn't look completely symmetrical. A stands for arm, which can be arm weakness or drift. Someone may all of a sudden not be able to hold their coffee cup or able to write, or may not feel their arm. And S stands for speech difficulty. So you may notice someone all of a sudden has either slurred speech or difficulty getting the words out, or they're looking at you and they know what they want to say, they just can't say it, or they're stumbling over those words. And if a patient has any of those signs or symptoms, it really is time to call 911, because when that happens, it activates a chain of events, which we're going to talk about.
Terrific. Thank you so much. Who's most likely to suffer a stroke, Dr. Kenda?
So excellent question. Most likely, it's usually older folks who have medical problems. But as you saw from the video, it can also happen to younger people as well. People who are maybe taking estrogen or birth control or hormones, or who have cardiac problems with their heart. So really, it can happen to anyone. But those patients with cardiovascular risk factors, which usually occurs with the older population, are at higher risk.
Thank you for sharing that. The pandemic is adding a significant layer of stressors. Can you share your observations about the toll that the COVID-19 pandemic is taking on stroke treatment and recognition?
Yes, unfortunately, a year ago, we didn't know how bad the pandemic was going to be and if it was going to overwhelm the healthcare system. So the initial message, unfortunately, that went out to our communities was stay at home. Don't come to the emergency room unless it's absolutely an emergency, so as to not clog the ER with coronavirus patients. However, unfortunately, over the last year, we have noticed that this initial message, which seemed to have stuck a little bit too well with the community, is that they're really not coming into the emergency department for emergencies, and stroke is an absolute emergency. Sometimes strokes, well, most of the time strokes are painless, so they don't hurt, unlike a heart attack where you may feel crushing chest pain. Strokes, either you have weakness or numbness, and so many times patients are waiting at home now hours longer than they did before the pandemic, sitting at home waiting for these symptoms to resolve. And by the time that they realize these symptoms are not going away, it's too late for any medical therapy at all, or too late for any treatment.
So once again, that takes us to the time. And I hope that call is not a stroke patient, Dr. Kenda. Thank you again for being with us. What at-risk populations are most affected by stroke, especially in our region? And are there specific factors that contribute to these trends?
Yes, absolutely. So definitely, patients who have diabetes, hypertension, which is high blood pressure, high cholesterol, who smoke or maybe use alcohol too frequently, or are obese. Are at higher risk for having a stroke. And we know those populations that have a higher incidence of, say, high blood pressure, for instance, like the African American population, those folks are at higher risk for having a stroke. And especially, talking about the greater Rome area and central New York area, we have such a large rural population that many times these folks don't have access to primary care doctors or preventative health care. And that helps them pick up things like cholesterol and blood pressure and diabetes, which they may not have any symptoms of, and they have no idea they have these medical conditions. So, those patients are really susceptible to having a stroke when they don't know what their underlying medical problems are.
Thank you for sharing that. Are there some experiences you'd like to share? You're a frontline healthcare hero to us and everyone in the area. What are you seeing out there?
Like I said, we're just really seeing that patients are waiting too long at home. They're not calling 911. They're not coming in early enough. And by the time they get to us, many times, if they don't show up within the first few hours of their stroke, they may not be a candidate for any clot buster medicine or any catheter related treatment to remove the blood clot from their brain that's impairing the oxygen flow to that part of their brain that is controlling that part of their body. And many times it's a sad situation where folks are really left with a permanent disability because they didn't seek medical attention early enough. So it really is imperative for them to call 911 to activate the EMS system. And because when that happens, EMS then calls the emergency department, and we clear the CAT scan machine, and we get ready to receive the patient, and we're on the front lines, ready to treat that stroke any way we possibly can.
Thank you. This conversation is reassuring me, and it's reminding me of the urgency to act quickly if we need to. Is there anyone out there who has a question for Dr. Kenda? Please feel free to put it in the chat box and we will try to answer it. We can also take some questions at the end of our presentation. So if something occurs to you as people are talking, please put them in the chat box. I think that we have another poll too while we wait for some questions to come in. Here we go. This is the one we've been waiting for. What does FAST stand for? You have a few choices: freak out, act irrationally, stamp your feet, tear your shirt, face frozen, arm raising, speaking quickly, telephone a friend, face drooping, arm weakness, slurred speech, time to call 911, fight or flight, ab tightness, stand your ground, text your neighbor. Go ahead and make your choice and we'll read the results. Terrific. Dr. Kenda, that's the answer we wanted to see, isn't it? Face drooping, arm weakness, slurred speech, time to call 911. Thank you. Our next panelist is Dr. Russell Silverman. He's the Chief Medical Officer at Rome Health. Dr. Silverman is a cardiologist and has been a member of the St. Joseph's medical staff for more than 35 years. He was a driving force for the growth and national recognition of the St. Joseph's cardiac service line. He has served in a variety of leadership roles. Currently, he is the Medical Director of Medical Cardiology and a member of the National Cardiovascular Services Clinical Excellence Council of Trinity Health. He received his medical degree at SUNY Upstate, where he also completed his residency in cardiovascular disease. Dr. Silverman, thank you for being here today.
Well, thank you for asking me. It's an honor and a pleasure.
Great. Can you talk to us a little bit, Dr. Silverman, about how hospitals and clinics are monitoring and supporting the ways that COVID has affected stroke recognition and treatment?
Yes, I can. Thank you. COVID has changed the way we do a lot of things and the way we take care of patients and the way we address acute issues such as acute stroke. The issue of acute stroke has been at the forefront for a number of years. Dr. Kenda has made sure that Rome Health is going to be at the forefront of that as well. our emergency department and the staff in the emergency department are ready to respond to people who come in with a stroke. We know that COVID-19 causes coagulation problems. We know that people who have had COVID may have a higher incidence of clot formation, whether it's in an artery or a vein, and that their risk factors become more important as the COVID infection progresses. So we need to be aware that the patient who presents with stroke may have other health issues uh, confounding the problem. The emergency department at Rome, as well as our surrounding hospitals that support all of us, have made sure that they are ready for stroke care and that our radiologists are ready for stroke care. So I would say that being aware of the need to treat any cardiovascular problem that comes in in this particular case, stroke is very important for people to understand, and that that Rome Health is prepared to treat them in the best way possible. Also, we have relationships with our surrounding healthcare facilities that can accept patients if necessary, though we can do much of the work at Rome and keep our patients local and don't have to necessarily send them out, but we are prepared to do so if the need arises.
Thank you. And again, I feel reassured about the safety so that when it's time to call 911, hopefully people will not hesitate. Dr. Silverman, can you talk to us a little bit about what's next? Where do you see the greatest need in the stroke system and hospitals and the community to further the conversation and make sure that stroke continues to be treated appropriately?
Stroke needs to be addressed locally and globally. But I think one of the most important parts of stroke treatment is trying to prevent the stroke in the first place. When a person has a stroke, we are prepared to treat them, as I said before, very aggressively at Rome Health and at the areas surrounding Rome. However, people need to understand that their risk factors are the most important thing that they can do to prevent the first stroke or subsequent strokes. And what people also need to understand is that stroke is another form of vascular disease, whether it's a heart attack, whether it's peripheral arterial disease, blockages in the legs, whether it is a stroke. It is very similar pathology, very similar risk factors, in fact, identical risk factors. Those risk factors are high blood pressure, high cholesterol, diabetes, smoking, and family history. The family history is not modifiable because it is history, but the other four are modifiable and are really up to the patient and their provider to address these issues. Healthcare is a team approach. It is not one person's responsibility only. So I recommend aggressive management of blood pressure, and we have very safe medications for that treatment. We have high cholesterol medicines, which are also equally safe and extremely effective, with many studies showing a reduction in vascular events as a result of aggressive treatment of high cholesterol. We have smoking cessation programs through many of our sister programs, and it is critical that people who smoke recognize smoking as a major risk for their health in general, but particularly as it relates to stroke. Diabetes I saved until last because it is a terrible disease that augments all of these other risk factors. And it is treatable. We have excellent drugs for management of diabetes, but it is a team approach again, and that needs to be addressed with the patient and their primary provider, as well as with their um, family. So the management of diabetes is critical to the reduction in stroke, heart attacks, kidney disease. All of these play into the same problem of vascular disease. One other issue that needs to be addressed, of course, is something called atrial fibrillation, which is a heart rhythm abnormality. It starts in the two top chambers of the heart, and those chambers stop beating in a regular, organized fashion and start beating in a very disorganized fashion, which leads to the development of a clot, particularly in the left side of the heart. That clot can break loose and it can go anywhere. But when it goes to the brain, it's a stroke. And you need to recognize the fast signs because this type of stroke is treatable, this type of stroke is reversible, and it is preventable. So everybody needs to understand who has atrial fibrillation, why they're being asked to be on a blood thinner, and why that blood thinner is so important to their well-being. As far as future care goes, we are developing programs across the country that are suitable for hospitals such as Rome Health to help reduce the risk and treat the stroke. If we can't do it here, we have relationships that can do it elsewhere. And one should not be fearful if it is recommended that they go to a facility of higher care so that these issues can be addressed.
Thank you, Dr. Silverman. That was a great deal of information. And thank you especially for responding to the AFib question, the issue of AFib. We did have a question in the chat box, which Dr. Kenda also answered there, but that was very informative. Thank you. Dr. Silverman, what can someone do to protect themselves, their families, and our community from COVID-19?
That's a very good question. I think people have gotten the message that the simple things, hand washing, masks, social distancing, are the critical factors to prevent the spread of the disease. I also think that the vaccination is critically important. There are little, if any, contraindications or reasons that you should not get the vaccine. And though it is true, it has not been tested like other vaccines have been tested, I think that the number of people that have received the vaccine and the incredibly small side effects that have occurred should not prevent you from considering getting the vaccination when it's made available to you. And any vaccine that's available for this disease should be considered. If you are offered the vaccine, give very strong consideration to taking it. It is a vaccine that will not only prevent you from getting the disease with a high percentage of likelihood, but will also help prevent you from giving it to someone else. And that will bring this COVID crisis under control. The other issue with COVID that I want to make sure people understand is that it is a very inflammatory disease, meaning that it inflames the arteries. It sets into series a sequence of events that causes clots to form, causes lung disease to worsen, and other diseases progress. So the issue of COVID-19 needs to be addressed on an individual basis, on a local basis, and on a national basis, which it is. And those of us who are involved with it, who treat people on the front lines, particularly Dr. Kanda, who sees them coming through the front door, not knowing what is occurring, need to be aware that the disease is rampant and it is coming under control. Also, I would like to strongly mention that do not ignore your symptoms. And I refer to that not just to stroke, but also to chest pain and heart disease. People are waiting out their stroke, and when they wait out their stroke, they lose brain, and when they lose brain, they lose function. People are waiting out their heart attacks, and when they lose heart muscle, they lose function. So time is tissue. In this case, time is brain. In the heart, it's time is heart, but the broader concern is time is tissue. Do not ignore your symptoms. call 911, get to the hospital, get treatment. The emergency department is a very safe place to be. Patients who have COVID or are suspected of having COVID are sequestered in one area. Patients who are not suspected of having COVID are placed in a different area. So we have taken all of this into a account, and do not ignore your symptoms. We have seen this with heart disease. We have seen this with strokes. And when I tell you that families and patients have suffered, it is true. You do not want to lose brain. It puts you in a very bad position. And I would strongly recommend don't ignore your symptoms. Let a professional such as Dr. Kanda and her team determine whether your symptoms are cardiac or stroke or whatever they may be. Just remember that every 4 minutes, somebody in the United States of America dies from a stroke, and we need to reduce that frequency.
We do. Thank you. That was very informative. We also had a question in the chat box about mini strokes. Can you talk a little bit about that? And do all people have mini strokes before a bigger event is one of the questions.
Those are very good questions. Mini strokes or transient ischemic attacks, TIA is another term you may hear, occur usually as a result of a cholesterol plaque in the carotid arteries, the arteries in the neck that go up to supply the brain. They can also occur as a result of atrial fibrillation that I previously mentioned. They may be a harbinger of worse things to come, and they need to be addressed. And we do that on a regular basis by looking at the arteries in the neck, looking at the arteries in the brain, and looking at the heart as a source of these tiny little blood clots that go up to the brain and cause a temporary cessation of blood flow to an area such as speech, vision, and then that goes away. And that's why it's a transient event, but it doesn't mean it isn't going to recur, and it doesn't mean that something worse isn't going to happen. I'm sorry to use all the negatives there, but that is the way to make the point, is that these transient events may mean something worse to come, and they need to be addressed, and they should not be ignored for the same reason that a major event that meets the FAST criteria should not be ignored.
Thank you. So please don't ignore things, everyone. You've talked a lot, signs, symptoms, things we can do. Can you give us one or two tips? What can people do to lower their chances of a stroke?
So this is very simple, but very difficult. Get your blood pressure down, take your blood pressure medicines. Don't run out of your medicines. Don't say, oh, I'll get them next week if you don't have any, because with some medicines, if you stop taking them abruptly, your blood pressure is going to skyrocket, and you are going to have something that can't be treated effectively, which may be a bleed in the brain. So you need to take your medicines regularly, get them refilled appropriately, keep in touch with your primary provider who can refill these medicines for you, and follow the instructions as to how you're supposed to take them. So blood pressure management is critical. We like to see people's blood pressure under 130 on the top number and under 80, closer to 75 on the bottom number. We try very hard to get that, and we try to get them even under those numbers if possible, if they're not symptomatic from lower blood pressure. The other risk factor that can be effectively treated is high cholesterol. We have very safe medications for high cholesterol. They are extremely effective, and multiple studies have shown that we can stop the progression of vascular disease, if not reversing it, by aggressive management of your cholesterol, meaning getting your HDL up as much as possible, which is not an easy thing to do, but getting your LDL, which is the bad inflammatory protein with fat attached to it, at or under 100 and closer to 70 if possible, also getting your triglycerides down. You have to remember that these risk factors are not independent risk factors. They all play into each other. Diabetes becomes a major player here because it makes your lipids worse, makes your blood pressure worse. So that needs to be addressed with your primary care very aggressively. Also, smoking cessation, which the American Heart Association has been so aggressive in over the years and continues to be, is such an important thing for people to recognize that cigarettes and cigars or other forms of tobacco are very dangerous to your health and shorten your life. The source of the nicotine, which is the damaging part of the tobacco, as it affects the uh, vessels, is not made any better by switching from a tobacco product to a vaping product. They're still getting the nicotine, still damaging the vessels, and it should not be considered a satisfactory replacement for smoking. There is no satisfactory replacement except smoking cessation.
Thank you, Dr. Silverman. And the American Heart Association and American Stroke Association is working very hard to end the smoking and vaping crisis in our country. Thank you, everyone who's here. If you have more questions for Dr. Silverman, please put them in the chat box and we will get to them before we finish. Now we have another poll. We want to know, what are the risk factors of having a stroke? Are they high blood pressure, diabetes, high cholesterol, smoking, family history, or all of the above? Go ahead and take a second and answer that. Very good, everyone. All of the above. And we also got some advice on how to change those. And we're here for you. Rome Health and the American Heart Association have all kinds of resources. So please don't feel you have to be alone. I like what Dr. Silverman said about a team approach. So reach out to your healthcare provider. We have one more panelist today, Paul Taylor. Paul is the president and CEO of AmCare Ambulance Services. As the leader of the 34-year-old family business, Paul has helped establish emergency plans with local government officials. He has been an EMT and EMT instructor for 27 years. He studied at Mohawk Valley Community College and SUNY IT. Paul, thank you very much for joining us today.
Thank you for inviting me.
Our pleasure. We're really glad to have you with us, and we're looking forward to hearing your observations and guidance about stroke treatment. How important is time, Paul, when spotting a stroke?
Time is extremely important. As both doctors have described to us, that time is brain, and the quicker that you recognize that you have a symptom and the quicker that you call 911, the better off you can be in the long run for recovering from a stroke or a possible TIA. Just as a bit of information, the brain cells survive on a couple of things, but oxygen is the main one. And as the doctors have described, if there is a clot there, the oxygen doesn't get to a portion of the brain cells. The problem is that although we have billions of brain cells, without oxygen, the brain cells actually start to die within 4 to 6 minutes of not having oxygen to them. We can't get those back. We could try to retrain our brain for other areas, but when after 4 to 6 minutes of no oxygen, the brain cells actually start to die. That's why it is so important to call early.
Time, that keeps coming back.
Yes.
Paul, can you take us inside your work a little bit? When someone calls 911 to report a stroke, what happens on your end?
When they call 911, there's something that we have in Oneida County that is emergency medical dispatch. Sometimes when people call 911, they get a little upset because the dispatchers will be asking questions of them. What everybody needs to understand is that during an emergency, if the emergency medical dispatcher is asking you questions, in the background, there is another dispatcher that is dispatching emergency services directly to you. So while they're giving you medical advice and they are trying to ascertain from you what's going on with the problem, we're already responding. So when you're calling 911, you're getting initially somebody from the 911 center giving you direction and also directing us to get to you as fast as we can.
That's really good to know, because I know, unfortunately, in tough times, people do feel like, why are they talking to me? So it's really good to know that the action has taken place simultaneously. Someone put a good question: what treatment begins in the ambulance, Paul?
We actually begin the process that the both doctors had described. When you get to the emergency room, what we will do is we will do a electrocardiogram. We will start a IV line, and we'll be checking all of the other things that could mimic a stroke, such as a sugar problem or a low oxygen problem. But we'll be starting an IV. We'll be putting on a cardiac monitor. We'll be giving you some additional oxygen supplementally. So when we get to the ER, we have knocked off the whole front end of what the doctors need to do, so they can immediately jump in and continue the care in the ER. And again, we come back to time. It's saving time.
That's really terrific. I know the temptation often is to just get in the car with the patient, but look at everything that you are already doing so that by the time people get to the hospital, that care is well underway. Thank you. COVID-19, how has that impacted care and response? And are there new challenges that you're facing?
Yeah, it's affected the response. There's a couple of different things that people are seeing, and they will see in the future, unfortunately, because this pandemic is not ending, at least in our arena, anytime soon. We're well on the way of getting it under control. But I think these mitigation factors that we all implement are going to be here for a while, such as when you show up and you see us show up on the scene, you probably see us putting on possibly gowns, definitely putting on masks and goggles and gloves. It is not because we think you may have COVID-19. It's because we treat every single patient, whether it's a cut finger or it's a stroke or a heart attack, the same way. And we have to assume that it has been exposed to COVID-19. So we can't transmit it to either ourselves, our families, or the emergency room and other patients that we bring there. So again, as Dr. Kanda had described earlier, the emergency room is one of the safest places because it's cleaned frequently and decontaminated. The ambulances are the same way. We follow the same procedures. And one of the things that have changed in this crisis is the protective gear that you'll see us get into. Kind of look like Martians, but everybody gets this gear. It's not because we think you may be sick, it's to protect everybody.
Terrific. You wear all the gear you need. Thank you for keeping us all safe. Paul, can you talk a little bit about your agency and the changes the pandemic has caused?
Our agency is, we are keeping very busy, but I can tell you that initially, believe it or not, initially in the beginning of the pandemic, our calls for service actually went down. And I think that is a direct result of the campaigns that were put out nationally, locally, of if you're not truly sick, stay home. Well, as both doctors had described, that I think it's been overly effective, actually, not seeing patients that should be going to the emergency room getting care, they're not calling. There is nothing more important than time. And if you are feeling as though that you're having a stroke or stroke symptoms, along with the, the face, the arm, it's time to call. It is not time to think, well, maybe this isn't something bad. Maybe this will go away on its own. You need to have it looked at, because again, we come back to the 4 to 6 minutes of not enough oxygen to the brain cells. We start to have some death of tissue. So we need to move and we need to get seen.
Time. It's so critical, isn't it? The pandemic has accelerated existing inequalities along racial and economic lines. Can you describe any of the disparities that you're seeing in some different communities?
Yeah, the main one that we're seeing is with the pandemic and the loss of possibly a job or income or working a couple of part-time jobs, the loss of medical insurance, the inability to get medicines. That has been a true economic impact for the patients. Patients are not calling when they should. They're not receiving care that they should. Unfortunately, patients with chronic conditions are not following through with their primary care physicians for such as yearly mammograms or going to your GI doctor or actually just having your once a year physical. All of these things are getting bypassed, mainly because of the pandemic. And we're seeing sicker patients because of it, because they're not following through the way they were before. So it's a double-edged sword. You're trying to protect your family and the public by staying home, but yet it is so important to get your normal medical needs taken care of. And if there is something going on, please call 911 and we'll get the problem taken care of.
Thank you. Thank you. I know we're all looking ahead to better days, and that issue of time and getting treatment and working with your healthcare providers. Dr. Kenda put in the chat box that 2 million brain cells die every minute until blood flow is restored in that blood vessel. So please, everyone, don't hesitate and share the knowledge with others that you know. If anyone has questions for Paul Taylor, please pop them right in the chat box and we will get to them as the program goes on. And now it's been a few minutes. Let's have another poll. Why should you call 911 right away when you spot a stroke? Is it because time is brain? Is it because time is money? Or is it because I need a better brain and money? Way to go, everybody. Time is brain. Thank you so much. So please be sure and make that call and take care of yourself. Great. If you have any more questions, please pop them in. But we have a question for you from the discussions that we've had with our three excellent panelists today. What's something that you found to be the most eye-opening? I know Amber, being so young, really surprised me. But we'd love to hear from you about things that really jumped out at you from today's presentation. I know for me too, the issue of time. I'm hearing the connection between COVID and blood clots. That was new information. So thank you for sharing that, Dr. Silverman. That was terrific. Also, don't miss those yearly appointments that they're being passed. It's knowledge. You know, we all know a little bit about COVID, but I think that all of our healthcare experts are really seeing so much more. So any information you got today that you can share with people, please, please do. So as we wrap up, I want to thank Dr. Kenda, Dr. Silverman, Mr. Taylor. Thank you for being here today. And especially we would like to thank Rome Health for bringing us this very important community conversation. And I know the one thing that I will remember from this is to call 911, and that acronym FAST is now stuck in my brain. I'd like to share a few dates with everyone. This was the first of 3 community conversations. The next one is on April 6th, where we'll talk a little bit more about high blood pressure. On May 11th, we'll have the 3rd and final conversation. We'll talk a lot more about prevention, and I know in May the weather will be better and it will be a little easier to get outside and maybe move a little more. And the big event that we wait all year for, America's Greatest Heart Run and Walk, is May 15th. You can register for that at America's Greatest Heart Run and Walk. The website's very simple, uticaheartrunwalk.org. And then looking ahead in June, we'll have our Go Red for Women luncheon. Ladies and gentlemen, thank you so much for joining us. Thank you to our panelists. Please, please, please take good care of yourselves. Thank you.